Cancer survivors, if you've had surgery or radiation to your chest wall, join me in the recovery room because though there are several important cancer stretches, I'm going to show you now the most important of them all. I'm cancer physical therapy expert, Dr. Leslie Walke. Both stiffness and loss of mobility in the cancer treatment area are relatively common because cancer surgery and radiation can cause shortening and thickening of the skin, connective tissues, and muscles in that area. The best way then to avoid or eliminate pain and stiffness is through a good stretching program. I'm happy to introduce you to Susan. Susan was diagnosed with breast cancer about 2 years ago and was treated with bilateral mastectomies with implant reconstruction, followed by both chemotherapy and radiation to her left chest wall. The stretch I'm going to have Susan demonstrate is called the trunk rotation stretch. A normal trunk rotation stretch requires full tissue mobility across your entire chest wall. Let's take a look at first Susan doing the trunk rotation stretch on her right side, which has normal mobility. You'll see that after rotating her legs to the left, she can still get her right arm all the way out to the side and up to her head. That's considered normal mobility. Now let's look at her left radiated side, which does not have normal mobility. Again, she'll rotate her legs to the opposite side that she's going to stretch. Palm up, elbow straight. And you're going to see she gets to a little over shoulder level and starts to feel a lot of tightness in her pectoralis major, which is an indicator that she needs to spend time stretching this area. She's going to hold her stretches about 30 seconds and probably do it about 2 to 3 times per set, maybe once or twice a day. Now to demonstrate the actual stretch, you're going to start with your feet on the table, knees side by side, and you're going to rotate them to the opposite side of the arm that you want to stretch. You'll start with your palm up, elbow straight, and then slowly slide your arm up and out, keeping it flat on the table or the floor until you feel a good solid stretch. All right. Now, if you can get all the way up to the top, you know that you have normal mobility. If you can't get there because you feel tightness somewhere along the range, it's an indicator that you need to spend time at that particular angle stretching. Again, about 30-second holds, maybe 2 to 3 repetitions, once or twice a day. And then when you get finished, you get to celebrate. Celebrate, Susan. There she goes. All right. Until next time, thanks for joining me in the recovery room. Stretch well. We'll talk again soon.